Hello, everyone. My name is Colleen Butler, and I am a registered nurse with my BSN and a family nurse practitioner student. Today, for my presentation, we'll be discussing a call to action, the family nurse practitioner as a research-informed practitioner. The purpose of this presentation is to discuss how family nurse practitioners are research-informed and play a vital role in bridging the gap between research and clinical practice. Family nurse practitioners have a responsibility to stay current with the latest research evidence and to use this knowledge to improve patient care. Evidence-based practice is defined as the purposeful use of current research-based evidence in making informed decisions regarding patient care. This is done by using the best and most current research evidence and the nurse practitioner's clinical expertise, as well as the patient's values. Best research evidence refers to the most current and reliable scientific research findings which provide a foundation for clinical decision-making. Clinical expertise refers to the family nurse practitioner's skills, experience, and knowledge that they have gained through their practice and their training, which they can apply to individual patient scenarios. Patient values refers to the patient's priorities and personal beliefs, which should be considered when the nurse practitioner is making clinical decisions regarding the patient care. There are many benefits of using evidence-based practice, such as improved patient outcomes, reducing healthcare costs, and enhanced patient satisfaction. Using evidence-based practices lead to better health outcomes for patients by promoting proven evidence treatments and interventions for patient care. Evidence-based practice can reduce mortality rates, decrease complications, and increase patient satisfaction. Evidence-based practice can reduce healthcare costs by eliminating unnecessary interventions that have been proven ineffective, by optimizing treatments that have been proven effective, and by minimizing waste or resources. Evidence-based practice also enhances patient satisfaction because it promotes shared decision-making, which means that the patient is involved in making decisions about their treatment plan, and the patients can feel confident in the quality of the care they are receiving. They feel confident knowing that the family nurse practitioner is using the most current and reliable resources. The family nurse practitioner can contribute to the implementation of evidence-based practice by staying current with the latest research and clinical guidelines. Family nurse practitioners must actively engage in lifelong learning in order to stay informed about the latest research findings to use in their practice. Family nurse practitioners can achieve this by attending workshops, conferences, and hands-on training in order to learn from the experts in their field. Joining professional organizations also allows a family nurse practitioner to network with experts in their field. Staying current with the literature. It is important for family nurse practitioners to stay current with healthcare literature. However, they need to know how to properly conduct effective literature searches, critically appraise the research, and must always be continuing their education. There are a number of different literature databases that can be used, such as PubMed, CINAHL, and Cochrane. PubMed has a comprehensive collection of medical literature. CINAHL has a wide range of nursing-specific journals with evidence-based guidelines, and Cochrane has high-quality systematic reviews that provide evidence on particular topics. Regardless of the search engine used, it is important to have a clear research question in mind, use key words and synonyms to narrow down the search, use words such as and, or, and not, and narrow the search to specific language and publication date range. In order for the nurse practitioner to critically appraise the research, it is important to evaluate the study design, sample size, data collection methods, statistical analysis, and the limitations and biases of the study. It is important to always use evidence-based articles published in the last 5 years to ensure that the data is the most up-to-date. In order to stay up to date on new research, clinical guidelines, and best practices, the nurse practitioner should always be doing continuing education courses. These courses can be attended online or in person at professional conferences. These are important because there is always new research coming out, and it ensures that nurse practitioners can stay informed on the most current and reliable evidence. Translating research into practice. Nurse practitioners can translate evidence-based research into their practice by identifying practice gaps, developing and implementing evidence-based protocols, overcoming barriers to implementation, and evaluating the impact of evidence-based practices. Family nurse practitioners can identify areas where evidence-based practices can be implemented or improved by reviewing existing patient data, to identify trends, areas of inconsistency, and poor outcomes. Doing so may indicate an area where evidence-based practice implementation is needed. Nurse practitioners are essential to developing clinical guidelines that integrate the latest research findings into practice for improved patient outcomes. In order to do this, the nurse practitioner would critically evaluate research finding as described previously, create a clear guideline outlining the recommendations of the evidence-based practice, including steps, decision-making criteria, and the rationale behind each intervention. Next, the nurse practitioner would involve healthcare professionals such as other providers, nurses, and administrators. This is done to ensure buy-in and implementation in the protocol development. Next, the nurse practitioner would provide training to all relevant staff members by addressing key concepts, rationales, and the practical application of the evidence-based practice. Common barriers to implementing evidence-based practice include lack of time, resources, or support. In order to overcome these barriers, the nurse practitioner can advocate for time to train the staff, ask for the necessary resources to implement the evidence-based practice, gain support from leadership who can help to advocate for the change, and use effective communication and management to facilitate the change into practice. Establishing an environment that encourages research-based practice integration will help to facilitate better clinical outcomes and improved patient care. It is important that once the evidence-based practice has been implemented, that it is evaluated and compared with patient outcomes to ensure success. This can be done by identifying the patient outcomes that should be monitored, collecting data on the changes of these outcomes over time, and regularly reviewing data to assess if there are any areas of improvement. Family nurse practitioners play an important role in healthcare because they are in the unique position of a provider who can use their nursing experiences and position of leadership to advocate for evidence-based practice clinical changes. Family nurse practitioners can serve as role models in fostering a culture of evidence-based practice. The nurse practitioner can do so by demonstrating critical thinking and evidence-based decision-making. This is done by actively assessing patient situations, considering the patient's preferences, their clinical experiences, and the evidence-based knowledge that they have, and by making informed decisions to provide optimal care for the patients. Family nurse practitioners can also serve as role models by staying current with the latest research and guidelines, and by then sharing their knowledge and expertise with their colleagues. The nurse practitioner's commitment to continuous learning and evidence-based practice leads to high-quality patient care and can inspire other providers to do the same. By actively seeking out and sharing new, up-to-date research, family nurse practitioners can encourage others to prioritize evidence-based practice and provide the best patient care. Family nurse practitioners can advocate for evidence-based practice by championing evidence-based initiatives within their organizations, collaborating with interprofessional teams to promote evidence-based practices, and by encouraging a culture of inquiry and continuous learning. In order to champion evidence-based initiatives, the nurse practitioner should demonstrate their commitment to the evidence-based practice by presenting the topic to colleagues, educate stakeholders about the benefits of incorporating evidence-based practices, and by gaining support from leadership who can help to implement the evidence-based practice. The nurse practitioner can collaborate with their interprofessional teams to promote evidence-based practice, which can be done by working with other providers, social workers, and other staff to implement the evidence-based practice change. Sharing the knowledge of the evidence-based research with the team can help to gain support and promote teamwork. This will also help to encourage a culture of inquiry and continuous learning. By sharing the research and how it would benefit the patient outcomes, other clinicians can discuss the literature and share their clinical expertise in order to help facilitate the best clinical change for the patients. Overall, evidence-based practice promotes a culture of continuous learning and improvement within healthcare systems, ensuring that patients receive the most appropriate and effective care based on the latest scientific evidence, ultimately leading to better health outcomes and a more positive patient experience. Family nurse practitioners play a vital role in implementing and advocating for evidence-based practices. By leading change initiatives, family nurse practitioners can foster a culture of evidence-based practices in their healthcare settings. By staying informed and leading these change initiatives, family nurse practitioners can improve patient outcomes and advance nursing practice. By embracing evidence-based practice in your role as a family nurse practitioner, you too can become an important leader and a champion of change in your own practice setting. And here are my references used for this presentation. Thank you for listening.